就大家而家見到咧就係 Dr. Timothy Tang， 咁咧就我認識咗好耐啦。其實嗰陣時佢未做醫生嘅，我仲記得嗰陣時咧我喺聯合醫院，佢咧就嚟做 elective 喎。即係而家做 elective 咧就好似好 commonplace 咁啊！我都有好多學生跟我，但係嗰陣時咧係即係好難先至入到嚟。嗰陣時我記得 Dr. Patricia Yip 咧就收咗佢過嚟做即係 elective student 咁樣，咁啊連續幾年啊，佢2年咧都喺兒科度，咁我覺得佢好苦心咧想做 Paediatrics， 好有興趣做 Paediatrics。咁後尾佢就做咗 fellow 啦，咁但係有一日佢就走嚟同我講，佢話我要辭職啦，我要出去做出去 practice 啦。咁我話好啊咁樣，跟住佢話俾我聽，我要出去做醫美啊咁。咁其實咧，即係 Timothy， 我真係話俾你聽，嗰陣時我都有啲嬲嘅。我話哇，即係你學咗咁多 Paediatrics， 你出去做醫美咁樣。不過後尾我又諗下，咦，其實個小朋友個儀容對佢嚟講都係非常之重要嘅。即係我哋可以醫啲organ system， 但係個容貌有時我哋未必做到。咁我就希望佢話：咦，你將來做一個好醫生，如果可以發揮咧，幫翻啲小朋友。咁咧，今日佢係要交功課啦，就話俾我哋聽，即係究竟佢而家 practice 緊呢個醫美咧，點可以幫啲年青人？咁好唔好啊？咁我不如將個時間交俾 Timothy。
好啊 ，thank you， 唔該你啊，陳醫生。咁我介紹下自己啦。咁啊 ，Timothy Tang 啦。咁我嗰陣時喺聯合醫院度都工作咗3年，做咗個 Paediatrician 嘅。咁喺嗰段時間裏面，我都好有幸啦。咁啊，醫院同埋陳醫生同埋我啲其他同事就容許我去到譬如英國啊、新加坡啊嗰度去深造，亦都係學咗啲 Paediatric Dermatology 嘅。咁之後就亦都係好 honoured 咁樣係可以係跟陸醫生啦，同埋佢團隊啦，張醫生嘅團隊啦，就喺嗰度咧就開始係佢哋成立咗一個胎記嘅激光中心。呢個就係我第一次接觸所謂嘅醫學美容嘅 experience 嚟嘅。其實咁當時就見到好似陳醫生話齋，好多啲小朋友係需要有啲儀容方面嘅改善嘅，咁可能就會係一個胎記。咁呢啲大家都見到係一個 port wine stain 啦。咁我哋嗰陣時係想當年就用一個，而家都係一個 gold standard 一個 pulse dye laser 去幫佢解決呢個問題嘅。咁嗰陣時亦都越做越細個，嗰陣時係去到陸醫生嗰個 team 係去到 neonate， 我哋都係可以做一個 MAC， 亦都可以去幫佢做到一個胎記，因為呢啲係越早去醫治咧係越好。咁所以呢個係我第一個接觸醫學美容嘅 experience。咁之後見到呢幅相好震撼啦。咁呢個其實個小朋友係一個好大嘅胎記啦。咁啱啱其實就係做完個激光，我諗大概4-5日度，咁我開始就甩緊啲焦。咁你見到幅相，其實初佢嗰個胎記咧係好唔開心。冇笑容嘅，咁你見到佢開始甩緊焦，雖然佢塊面可能都仲有啲痛，有啲地方係好似有啲損咗咁樣樣，咁不過你見到嗰個笑容呢，係令到你真係好開心嘅。咁所以抱翻同一個心態，咁我都開始即係去我 private practice 嗰度呢，咁我就諗下咁其實我都會好想去幫下其他人嘅。咁個原意點解今日同你哋講呢個咁特別嘅 topic， 就係因為呢一樣嘢醫學美容咧已經成為即係越嚟越普遍啊！咁唔多唔少咧，其實 Paediatrician 都會有機會去接觸得到。咁成日都會有人問我我個女女14歲可唔可以做脫毛咧？我個女女15歲佢比較多汗喎，隻腳或者隻手或者腋下可唔可以打 Botox？ 咁呢啲其實都係一啲好常有人會問我嘅問題。咁甚至再誇張少少，有啲人可能會再細個少少，可能 Paediatrician 我哋都會20頭都會有時都會 follow up 啦。咁佢問我喂，咁我 SLE 我又想高啲喎個鼻，咁我打嗰啲前沖劑係得唔得嘅咧？其實有時我啲同事都未必去識答，咁所以我就想用呢啲時間咧去分享我個 experience， 咁都盡量擺喺一個少少 pediatric 嘅 context 啦，同埋都介紹一下究竟我哋醫學美容嘅人所謂嘅針劑啊，去打啲嘢塊面度啊，係啲咩嚟嘅咧？因為啲人係好驚嘅。咁所以嗱，呢個客人。咁我都係好似小朋友咁啦，哇！除晒佢啲斑，好開心。其實真係 發覺自己都依然係一個醫生嚟，咁依然都係幫到好多嘅人嘅。咁究竟我係幫到佢啲乜呢？咁好明顯呢幅相見到嘛，啲斑就冇晒啦。咁可能我又脫咗佢眼蓋上面嗰粒癦，佢啊即係十分之感激其實。咁你再睇下一幅相，原來又唔係喎嗱，佢眼側邊啲皺紋又會淡啲啊，佢虎紋又好似深啲，佢望落去好似又後生咗10年左右啦，或者多啲。咁究竟我係做咗啲乜？咁其實醫學美容呢係一樣好複雜嘅嘢，其實都不但止係激光，其實我哋有好多嘢係可以去做嘅。咁亦都有好多嘢可以出錯嘅。咁呢啲係啲網上揾到 example 啦。咁呢啲係好恐怖嘅例子嚟嘅。咁可能係個病人自己要求啦，可能會係個醫生嘅審美眼光，或者佢貪心啦。咁總言之，佢做呢啲嘢呢係好似係逆咗 nature 嘅，好唔 natural 嘅，你望落個樣。咁所以我哋即係身為醫生，其實我都有個 duty of care， 對嗰個病人係唔會搞到佢咁樣。咁其實呢個變咗係一個學問嚟嘅。其實咁因為 medical aesthetics 其實以為係啲好 recent 嘅嘢，係1925年其實由最初嘅 silicone 打落去即係 post breast surgery 已經係做啲 augmentation 㗎啦。咁去到1987年啊 Botox 就可以攞嚟打去啲 strabismus 啊或者 blepharospasm 啊。咁03年咧就開始有啲 filler 去改善你嘅儀容，去減慢你嘅老化，譬如打落去 nasolabial fold 嗰度。咁所以其實慢慢我哋係有轉變。咁而最近呢10年咧，其實個變化好快，好似 all areas of medicine 咁樣。咁去到呢一刻咧，嗱我就 Nicam 咁轉一轉翻英文啦。Okay, so let's look at medical aesthetics. So this is Allergan. Allergan is the largest company in the US that does medical aesthetics. You can see that its revenue is climbing from 2012 up to 2019. It is increasing quite rapidly. And likewise in China as well. The China aesthetics market, the value of the aesthetic market is gradually increasing proportionately over time. And the age is getting younger and younger. So this is a source from the United States. So in terms of medical aesthetics procedures, the average age is about 35 to 50 would be the most number of people that would do medical aesthetics. And if we were to split this age range into finer statistics in China, you can see that the statistics, 20 to 25 years of age is the most number of people that would undergo medical aesthetics treatments. Now, what is medical aesthetics treatments? It is basically the science of making your face look younger or to change the way of your face to repair a defect. Now, at the moment in time, it is not necessarily a specialty in medicine. Even in pediatrics, it was not an official specialty in the US until the 1800s after the Civil War. Previously, medical specialties were focused on a particular organ or particular technology such as radiology or cardiology. But Dr. Jacobi, the founder of modern pediatrics, thought that pediatrics should be beyond mere disease. It should be disease prevention. It should be hygiene. It should be feeding in healthy children. It should be a social science, children's rights, and parent education. So with the formation of the American Pediatric Society, it became a distinct branch of medicine away from what was previously under obstetrics. So likewise, in medical aesthetics, it's a gradual change. So you can see there's the Royal College of Paediatricians that we are all a member of. But there's starting to become different colleges of aesthetic medicine all around the world. And in fact, many prominent universities are offering courses on aesthetic medicine. So perhaps the trend someday, it will be a medical specialty. Who knows? But for now, let me just share my interests and my knowledge with you. So medical aesthetics, it seems like such a hard and abstract concept, but it is like any other medicine. It is a consultation process. So when we first see a patient, we would introduce ourselves, introduce the patient to us. We would discuss treatment goals. Now, what are these treatment goals? It can be improvement of your appearance, and this would give you self-confidence. Perhaps you're looking for a more youthful look. We would also have to do a physical examination. And what is this physical examination? We don't have any books that teach us how to do a physical examination, and we do not have any formal examinations. But let me try and go through some of the thoughts of a medical aesthetic physician with you. So as we grow older, our face changes from an inverted triangle into a proper right-sided triangle. You can see that the face contour is very smooth when we're young, but as we age, it becomes irregular. So what are some of the underlying processes that happens as we age? So our skin would have wrinkles and our skin becomes saggy. But why does it become saggy? It turns out that underneath the skin, there's a lot of collagen loss, there's bone remodeling, and there's fat redistribution in all of our face areas that results our loss of our youthful appearance. So what happens underneath the skin is something that we don't really realize. So there's actually a lot of fat pads underneath the skin that support our face, much like my suit here. So my suit has shoulder pads. It has padding within the back areas to give the suit a lift, to give it firmness, to actually support that structure. Once there's loss of this fat, then our face loses its structure as well, and the skin sags down, just like a suit would become saggy once you lose all the padding. In addition, our muscles become thinner, our bone will resorb, the mandible becomes thinner, our orbital rim enlarges, and these are all the things in aging that leads to the overall end appearance of sagginess and loss of firmness. So there's a lot of, even in social media, ways that we can change our face. Basically, in terms of the Chinese aesthetic, what we call as a gold standard, we would want 上邊圓,下面尖,鵝蛋面型. That is what we would term as aesthetically beautiful in terms of the Asian culture. Okay? So 有分外輪廓,有分內輪廓,外輪廓就要順滑,內輪廓就要填充飽滿,咁先至覺得係會係即係比較後生啲個樣。咁所以 it's a fine line of what we can do in order for our face to look normal and not artificial like some of the pictures that I have showed you. And there's many ways that we could do that to delay aging. I mean, our aim in medical aesthetics is not to age. If I were to give someone, some 80-year-old woman, the cheeks of an 18-year-old, everyone would know that is something is wrong. 即係好似點解黃夏蕙會覺得有啲奇怪？咁因為佢個蘋果肌可能係一個25歲嘅蘋果肌，咁你唔應該咁噶嘛。即係個個同學都見到我，即係我慢慢我都會老。咁如果我翻到嚟我樣就脹晒，咁 something obviously very amiss about the way that I look. So let me try and go through some of the things that we use, some of the tools and treatments that we do for medical aesthetics. But of course, there's really too much to cover. So in its own, it is almost like a medical specialty. So for the purpose of today's talk, I will focus on just the injectables because this is the thing that most people are most unfamiliar with and it seems the most scary. 哇，會唔會膠面嘅醫生會唔會變咗好恐怖嘅個樣？ So in terms of medical aesthetics, there's a number of things daily in my clinic that I would inject. One would be botulinum neurotoxin, or what most of people would know as Botox. There would be fillers. In PRP and some other clinics, 即係啲生長因子啊. So we sort of centrifuge our blood and we inject it to get all the growth factors in order to rejuvenate our skin. We do lipolysis to dissolve fat underneath the chin or in unwanted facial areas or even on the body. And we even do some dermatology, so intralesional steroid injections for acne, for keloid scars, or for some granulomas. So what is botulinum neurotoxin? So a number of you can see there are different brands in the world today. The first ones on the top are the three most commonly used in Hong Kong. So there's Botox, okay? So what we term Botox is actually a brand. Just like we use Tempo or Kleenex, and we 好似當紙巾咁, it's actually a brand. This one is from the US, Dysport is from the UK, and Xeomin is from Europe. And down below, there's several ones from Korea as well as in China. So what is botulinum neurotoxin? Everybody knows that botulism is a disease. Previously, from the 1800s, there was an outbreak in foods that were not preserved properly, was not refrigerated properly, and this bacterial toxin would paralyze the intestines and cause disease. But if we were to use this toxin on our face, it becomes very effective in reducing wrinkles. So this particular toxin, there's serotypes A to H. Commonly used in medical aesthetics is type A, or sometimes type B in China. There's other C to H, it's not commonly used at all, commercially available, and there's some that do not cause an effect in humans, and there's actually only affects animals. So this molecule will target the nerve receptors, and it blocks the release of acetylcholine into the synapse. And in that sense, it will inhibit muscle contraction. The process, thankfully, is fully reversible and recovers with time. So there are FDA-approved uses of botulinum toxin. So there's strabismus that we use for pediatrics as well. For blepharic spasm, 眼眉跳, we can also do it. Spasticity with cerebral palsy has been used for decades. And the dosages are actually very high compared to the face. So in terms of medical aesthetics, it's actually quite safe. Cervical dystonia, abnormal movements, hemispatial spasms, myoclonus, even in tics and Tourette's syndrome, they would inject Botox into the vocal cords in order to prevent the vocalization of coprophagia. And it is FDA approved since 2010 for migraine, chronic migraine headaches, and trigeminal neuralgia. It's been used for urinary incontinence from detrusor activity. And of course, we do have FDA approvals for upper face cosmesis. Off-label uses also commonly used in medicine for various pain syndromes. It can be used for temporomandibular joint disorder and for grinding your teeth during sleep. There's even some new studies that we're pending the effects of to be used for colloidal scarring, to be used immediately after surgery in keloid-prone individuals in order to reduce the muscle contractions in the skin areas of the wound to reduce the colloidal scarring. And we look forward to these study results. And what are the contraindications for botulinum toxin? So if my patient were to ask me, can I have Botox? What patients must not have botulinum toxin? It would be those with neuromuscular disorders or myasthenia gravis. So sometimes you would read in the paper, someone went to a clinic for Botox and they would have trouble breathing and they'd be hospitalized. Perhaps they had an underlying neuromuscular disorder, or perhaps they had too much. In any case, we must avoid it in these sort of patients. Usually, these sort of Botox, for it to have actually caused systemic disease, 可能會水火. Perhaps the concentration of the Botox that we use from import from other countries is different from the licensed products that we use in Hong Kong. So for example, a bottle of Botox would be 100 Botox units. Sometimes the ones we bring in from overseas, 水火, that the sort of illegal clinics would use might have 500 units. If you were to use the same amount and the dilution that you use normally, then this would cause a problem. Patients with ALS must not have Botox. ALS is a syndrome of a myopathy of people like Lou Gehrig, a basketball player, or Stephen Hawking, those of you that might be familiar with him. Any allergies to Botox toxin, of course. Anybody that has a body dysmorphic disorder that does not know exactly what they want, continually doctor seeking in order to improve their face or to have Botox injections. 呢啲一問就知㗎啦，其實不停去唔同嘅醫生，成日都打對上一次2個禮拜前，1個禮拜前。We must also avoid Botox in those that are pregnancy and breastfeeding. I really think it would be safe in breastfeeding, but we would not want anything to happen to the infant. And we want the mother to continue breastfeeding exclusively for 6 months. So usually in our clinic for any aesthetic treatments, I would tell them to come back after the baby is 6 months old, at least. So what are the types of wrinkles that we would want to improve in Botox? There are static wrinkles and there are dynamic wrinkles. So dynamic wrinkles are the ones that appear with facial expressions. So if you look on the man frowning on the left-hand side, he's doing a facial expression of frowning. But even though he relaxes his frown, you will see that there are static wrinkles that remain. So on the face, we would commonly use it for these frown lines. In fact, it was one of the first indications of Botox was for the frown lines in the glabella. We also use it for crow's feet around the eyes, around the nose areas, and also the forehead to reduce forehead lines. The dosages are actually very low and very safe, and we would inject it all over the face in these particular muscle areas in the frontalis, the procerus, the nasalis, as well as the corrugator muscles for the forehead and the glabella. The orbicularis muscle is someone that we target for the crow's feet. And off-label use, we would also inject the masseter muscle, as well as the mentalis to reduce the wrinkles there, or to even reduce a gummy smile. Perhaps you smile and you show too much of your teeth. There are ways to improve that as well. In Westerners, you will see these sort of platysmal bands. We can inject Botox on the neck to alleviate these. And also, we also use the sort of dynamics of the face to create lifting. So the muscles of the face actually pull upwards, and the muscles of the face pull downwards. If we were to inject the muscles of the neck and relax the downward pull, the muscles of the face would continue to pull upwards, and the face would actually have an artificial facelift. So it's something that you can actually do very simply in your clinic without having to do surgery. The use of botulinum toxin in chronic migraine is very useful. Perhaps some pediatric neurologists might be using this already. So we would inject the same amounts or smaller amounts that we use for forehead wrinkles and glabellar frown lines, but we would extend the Botox to the occipitus, the temporalis muscles, and also to the cervical paraspinal group and the trapezius. We would use about 150 to 200 units altogether, depending on whether it's male or female, and the thickness of the muscles as well. This is actually quite effective and therefore received the FDA indication in 2010. We also inject the masseter treatment. Now, this has a sort of double use. This would improve bruxism, which is grinding your teeth in your sleep. A lot of patients come to me because they wake up with the jaw feeling very tense, or their partners are complaining that they're grinding their teeth and disturbing their sleep. Or it gives them a migraine, or gives them very much discomfort during the day when they are awake. Injecting these muscles also results in a slimmer face. So 之前話上邊圓下邊尖咁塊面點樣去尖呢？除咗做啲儀器之外 we can very simply inject the masseter muscle and create the illusion that the face is slimmer by reducing the mass of the masseter muscle. We actually inject this every 3 to 6 months, and it is very, very effective. Clinical studies show that after 3 months, the muscle thickness is reduced for about 30%. In my clinical experience, by 1 month, it is reduced by at least 50% on average. And after people that do not chew on hard things all the time, or for people that do not grind their teeth, actually have this sort of semi-permanent effect, and they come less and less often. So the treatments might become 6 monthly, yearly, or even several years they come for one treatment. But again, this is an off-label use. We can also inject non-face body areas. The most common areas in Hong Kong are the calves, to give the sensation of a smaller calf, or the trapezius muscle in order to relax any tension that you might have, or to give a swan lake sort of contour, 天鵝頸啊. So for those ladies that are planning to get married, you can inject this area to give you a better neck contour for your wedding dress, or inject the masseter muscles to give you a slimmer face for your photos. In terms of clinical use, we can also use it for hyperhidrosis and bronchidrosis. It is also quite effective in order to reduce the amount of sweating or to reduce the amount of odor in the underarms. And some patients come specifically for that. The treatments are done every 4 to 6 months, depending on the amount of sweating and the degree of bronchidrosis. And it reduces sweating by more than 80% on average, and patients tend to be quite happy for the results. You can supposedly also inject it on the hands for hyperhidrosis as well, but we have to be very, very careful, because if the Botox were diffused in the other hand muscles, it would affect the hand movement. So I tend not to do that, and we refer to dermatologists for the other treatments for hand hyperhidrosis. And so we inject about 100 Botox units per side. So what about fillers? Fillers is something that is very, very interesting. So there are different brands of fillers. I've divided it for the ease of this talk onto 2 main groups. On the top, different brands of the fillers that were used from Europe and from the US that are hyaluronic acid based. The fillers on the bottom are collagen stimulators, okay? And they're also from various countries in Europe as well as the US. So let me tell you a bit about those. So tissue fillers have been used since the late 1800s. The first use of autologous fat to reconstruct facial defects was by Newburn in 1893. Guernsey in 1899 used paraffin as scrotal prosthesis following resection of tuberculosis of the testes. Synthetic materials such as silicone were used since the early 1940s for use as tissue fillers because it's readily available without donor site morbidity, so you do not have to harvest the fat from your own body. And then with the revival of liposuction in the 1980s, there was a revival of autologous fat transplantation for the face. But since the 1990s, human and animal collagens were used. Initially, there was bovine collagen from cows' eyes, but a lot of people developed sensitivity reactions to this sort of bovine collagen. Bovine is cows. And then we moved on to porcine collagen from pigs, from their tendons or from their skin. And these had better results and less sensitivity issues. But we were able to develop human collagens as well. But these, in the end, also created a lot of granulomas and a lot of hypersensitive reactions. So now we use more inert substances. And the first hyaluronic acid fillers, were approved since the early 2000s. And these were produced by Streptococcus bacteria through genetic manipulation in the laboratory. So the types of modern synthetic tissue fillers are, as I mentioned, hyaluronic acid, collagen stimulators on their own, or collagen stimulators with a carrier gel. So what are the contraindications to tissue fillers? What patients cannot have it? And this is something that I've learned doing this talk as well. It turns out that there's actually no strict contraindications in terms of disease, but I say this with caution. So of course, any allergy to the filler component or the lidocaine within the syringe is a contraindication. Any active infection or disease in the site that you want to treat cannot be done. And pregnancy and breastfeeding, we should also avoid. It turns out that these are relative contraindications for patients with autoimmune disease, dermatomyositis, poliomyositis, SLE, RA, scleroderma, any patients at risk for granulomas, uncontrolled diabetes, immunosuppression, or risk of infection, cancer, and clotting and bleeding disorders. Now, I say this with caution because I do not treat any patients with any sort of immunosuppression or autoimmune disease, and I would advise you to do the same. There are reports reported of strange reactions with these patients. It's not a strict contraindication, but I think we should have a duty of care and be safe as much as we can. We'd also advise patients that had recent vaccinations not to have fillers as well. There has been many new reports of patients having COVID vaccine, flu vaccine, or even flu or COVID infections of having within 1 month of these sort of procedures or of their disease, having a risk of sort of like a hypersensitive reaction. So I think I would advise caution in these patients as well. So what are the side effects of filler injection? Of course, the most common effects are the ones that are due to injection as well. Bruising, swelling, redness, itching. These are quite common, maybe less than 1 in 1,000. Very rarely, there's allergic reactions or hypersensitive reactions or nodules or inflammation. Due to injection technique, sometimes there's tissue necrosis with blindness. That is a very scary thing. I'll show you some pictures of that later. And then also granulomatous reactions, migration of the filler, and also scarring, fortunately tend to be very rare. This is avascular necrosis after filler injection. So sometimes patients have their filler infection, they may come see you and they would have, doctor, I'm seeing you for my asthma, but my forehead is really painful, or my eye is really painful, or my cheek is really painful. And what have you had done? It turns out I had a filler injection. So this is something that should be very alarming. So this is a filler that has gone into an artery or vein and has blocked the circulation. So sometimes you see them as a pediatrician, they may be slightly red, or in fact, you might see vesicles or scabbing and crusting. You must alert the physician that has injected it. It can be very serious. So it can be from sort of a mild bruising, and gradually as the vascular occlusion becomes more apparent, then there is necrosis of the areas that you inject, vesicles, infection, scarring. And there are management things that we can do. So if we were to pick these things early, we would inject Hyalase. Everyone's familiar with Hyalase, right? For extravasation of, say, TPN. We would inject this into the injection areas as well. We do warm compresses. We give a nitrous patch to people that we use, these patches that we use for ischemic heart disease. And to dilate the sort of vessels on the face, we would give aspirin, antibiotics, oral steroids, reduced inflammation, and the most effective gold standard thing is hyperbaric oxygen. If we were to do that within the 48 hours, it greatly improves the outcome the vascular occlusion. We actually have 2 centers in Hong Kong that have hyperbaric oxygen. So one is in Ap Lei Zhao. And it is a private one that if anyone were to need this sort of contact contact me, I will provide the details if they wish. So back to what we're trying to correct. So if we were to inject fillers, what are we actually trying to do? So we're trying to improve the bone loss, the volume loss from the fat loss, and also the tissue displacements. But we're also improving the skin quality as well. So let's first talk about hyaluronic acid. So what is hyaluronic acid? Everybody knows about it. It is present normally in our skin. It is used to bind water. Women use it for serums in order to keep their skin looking young. Because why? Because it actually is water binding. 1 gram of hyaluronic acid binds 6 liters of water. So if we're to apply it to our skin, it greatly improves the hydration of the water. And also, it also promotes wound healing. And the native hyaluronic acid gradually declines as we age, broken down by our own body's metabolism. So the highest volume of hyaluronic acid is found in the skin. Of course, it is found in other organs as well. A lot of orthopedic surgeons were to inject it into our joints. It is found in other tissue structures as well as organs such as our muscles and intestines. But for the skin, it is used for water bounding in order to maintain its integrity to protect us from the outside world. So what is the limitations of hyaluronic acid as a filler? So you put it on your face, it doesn't last for very long, doesn't it? It lasts for maybe 1 to 2 days, several hours. But there are ways for us to make the hyaluronic acid last longer if we were to inject it under our skin. We use cross-linking. So basically, chains of hyaluronic acid, we use a chemical way in order to bind it to create higher molecular weight, larger molecules. So if we were to inject it into our skin as a skin booster, we will want something that is non-cross-linked. If we were to inject it deep within our skin to restore a structure, then we will use tightly cross-linked, high molecular weight hyaluronic acid. And the different amount of cross-linking varies between different brands of gel, different brands of manufacturers, as well as within the same brand, different lines as well. So what are we thinking about when they created the different brands and the different lines of hyaluronic acid? So it is basically we want how much support we have and how much flexibility. So you want something really hard, we have to inject it very deep, but it gives a very good support. But if we were to inject it very superficially, you would see it, and the result is undesirable. Do you want something really hard and you cannot mold it? But when you smile, it might stick out. So we want something that gives a degree of flexibility. So the support and flexibility is inversely proportional. So as a medical aesthetics physician, we would think about the viscosity of the product we're using, how elastic it is, how it will integrate in our tissues, how much molding we would want in order so we can press it, and when we inject it so it'd be more forgiving. So if we were to inject the forehead, of course, we would want something that's quite soft. We're injecting into very thin skin and something that would not show up. If we're to inject it into the temple, we can inject it very, very deep, something that had good support. So we can choose something that is a very firm hyaluronic acid. Around the eyes as well, the skin is very thin. And around the lips, we want something that is very soft, or else we don't feel like don't want to be feeling it when you're kissing someone. In terms of the jawline or the cheek, we want something that gives much more support. So these are photos that were provided to me from the drug company, so I'm referencing the drug company, but I am not in any way promoting this particular brand. So this particular patient, you can see, they would come to you and they would explain, "Doctor, my friends say that I look very tired. I would want to improve the way I look. So what's wrong with her? So her eye circles are dark. It sounds like there's something tiredness under the eyes. The nasolabial fold seems quite prominent. So these look like there is signs of aging. And the cheeks look like it's sagging down a bit. So the first treatment, we would inject, say, the nose, give a face a bit of a contour, a bit more support, and the cheek, and the nasolabial fold. And with the second treatment, we'll inject the temples to give more filling, to give a sensation of youth, because as we age, the forehead loses its fat layer, and the forehead becomes lumpy. And we will also inject the temples as well, which also loses fat and the underlying bone. And so you can see gradually the patient becomes more lively, younger, and energetic looking. Same problem with this patient. Also, underneath the eyes is very tired. So we inject the cheeks to give the eyes a bit of a support. We inject the forehead and the temples, and it's quite obvious that the patient becomes looking more youthful. So now, I don't want hyaluronic acid. Why? Because it is very lasting, and because there is something called a Tyndall effect. So everybody knows that ocean water is clear, but if you inject it into the skin under certain lighting, it might look blue. So what is something that would be more natural? So eventually the companies came up with something that replaces collagen. So let me talk about collagen stimulators. So the first collagen stimulator was used in the early 1980s, but recently approved by the FDA in the early 2000s. And this is PLLA. So PLLA is polylactic acid, or poly-L or poly-D. These are the different isomers. And it's a biodegradable biosynthetic polymer, widely used in reconstructive surgery in different pins, screws, bone and tissue implants. And in the late 1980s, it was used in HIV patients with lipoatrophy. So some of the HIV treatments would result in giving them lipoatrophy. And it was used to restore the hollowness that these patients experience. And subsequently, it was extended to use in cosmetic medicine. Now, the first PLLA were crystal structures, microparticles that were very irregular. And these actually caused a lot of problems because the underlying mechanism for these PLLA to work on our skin to stimulate collagen is actually a foreign giant body cell reaction. So you cause some sort of inflammation to recruit macrophages and subsequent stimulation of fibroblasts. And these fibroblasts would create collagen, both type 1, the collagen that's the most numerous in our skin and the most desired, and also some type 3 collagen, which is the type of collagen that you see in scarring and fibrosis. But gradually, as technology improved, it created microspheres that were smooth, and this resulted in less of a foreign body giant cell reaction, and so there were less problems with these sort of fillers. And so, what sort of patients would desire these fillers? I would want a gradual change, usually. Hyaluronic acid, if you inject it, you change immediately from the moment you leave my clinic. There are patients that say, I don't want my husband to know. I don't want my boyfriend to know. So this sort of thing that would require 2 or 4 treatments in general, and you will choose, and we will change gradually over time as your collagen develop over about 6-month periods. So people are very happy with this sort of slow gradual change. For people that want an immediate change, then they would choose a hyaluronic acid. So if you want to look good for Christmas and it's already November, then you would want hyaluronic acid. If you have plenty of time and you don't want your relatives to know, then you would choose a collagen stimulator. So this is something as an example of one of the collagen stimulators as well. You need multiple treatments, so this lady had treatments in 3 months, 12 months, and her result at 24 months. So again, like the previous slides, she had injection of the forehead, the temples, the tear trough, which is the sort of a hollowness, deep depression around the eyes, under the eye area, the cheeks and the cheekbones, the nose and the chin. And gradually, she looks more energetic and less tired. Same with this lady here. Okay, as the fat loss, she says, I look more angry. How can you make my face look softer? So with filling of the face, her face looks less masculine and more feminine. This man also, with the help of some surgery as well, removed the tired look under the eyes. Even men can have these sort of treatments. And this man also, okay, I'm starting to look very old for my age. How do I look younger? So you can see that his face is plumped up. So this is sort of a very soft look that collagen stimulators tend to achieve. But they do have problems, okay? If the doctor injects too superficially, or if the patient sometimes has these sort of reactions, you find nodules, okay? So again, as a pediatrician, you can report this to the physician if you see them in your patients. Because there are management that we can do. Sometimes if it's just a recent nodule, we can use normal saline and try to break apart these sort of nodules. Perhaps it is the inappropriate reconstitution of the product. Sometimes it is immune reaction, and we have to do triamcinolone intralesional steroid injections. So causes of formulation of these nodule formations would be product is too concentrated, the doctor time some, injected too many bottles. The intervals between the treatment was too short. Sometimes we ask the patient to massage the product after the injection. Perhaps they didn't do it properly. Also hyperkinetic regions, so the forehead, the lips, we cannot inject these areas. Now, if there are patients that go, well, I want an immediate effect, but I also want my own collagen. I don't want some hyaluronic acid where I can feel or that it looks blue. What do we have now? Now you have collagen stimulators with a gel. Okay, so for those that want an immediate effect, but eventually having their own collagen. So these are one example. This is PCl plus CMC. So what is PCl? Polycarboxyl lactone. So it is a bioresorbable non-toxic polymer, and these are also metabolically inert and can be metabolized and excreted naturally. And so as the technology advanced, these particles tend to be smaller and also smooth surface microspheres. And these tend to reduce the foreign body granulomatous reactions, and they have become safer and safer. And the CMC gel is a carbomethyl cellulose gel, okay? So basically the gel is something that would hold the collagen stimulators in place as we inject it. It will give immediate effect, and then gradually as this gel is metabolized, you'd be left with a PCl that would stimulate collagen. So now there are numerous brands that are both CE and FDA approved. And these commercial products have been available for the decade. And they gradually resorb by our body over several weeks to months, and they would gradually increase the amount of neocollagen stimulation, neocollagenesis. So how does it work? So again, we inject the areas that are of a defect. The gel will create an immediate lift. The gel is resorbed, and the PCl microspheres would stimulate collagen and create collagen fibers. And over time, these corrections would improve. And there are studies that can show. So there are volumization studies so this particular product, Elance, is a CMC gel plus PCl. And over the course of several months, usually 3 to 6 months, there is an automatic volume increase even after one injection. And again, tired look, and you become a more plump look. You can also target specific areas for people that desire it. And what other brands there are and what other types? There's also calcium hydroxyapatite plus CMC gel. So calcium hydroxyapatite is actually a natural bone component and a biostimulation of collagen. And it's been used in various dental, orthopedic, and urological applications for over 20 years. And in FDA, this particular product has also been approved by the FDA to correct lipoatrophy in HIV patients. So again, it is the CMC gel in varying proportions with calcium hydroxyapatite, and you have to inject this very deep. Otherwise, you might create nodules in some patients. And after the gel is absorbed, over the subsequent 2 months to 6 months, there's increased amounts of collagen and the defects are filled up. So I won't bore you with various pictures of people looking good, but again, it can achieve very natural effect. And the most recent one has a combination of all the best things of the fillers I mentioned. So there's a calcium hydroxyapatite, a collagen stimulator with hyaluronic acid. So again, it's a gel with a proportion of collagen stimulator. And the good thing is CMC gel tends to have a lot of facial swelling because it attracts a lot of water. So hyaluronic acid tends to be more inert and something that we already have. And it also improves the appearance of our skin. And so with a combination of these two things, it was currently one of the more newer fillers that we have. And this is also an example of the lifting effect that it can have as well. You can see from this patient that not only the contours improve, but you can see that the face is lifted. So around the mouth area 有啲木偶紋係咪啊？ Just sort of like this sort of wrinkle that goes along the lips down to the chin. So with the injection of the area and the sort of C-shaped areas that I have in the diagram up above, you create this sort of artificial lifting effect. And over time, the skin quality improves as well. So I've sort of very rapidly gone through some of the main injectables of medical aesthetics, and I will leave a little bit of time for your questions if you have any.
好，咁咧好多謝Timothy 大開眼界嚇。不過我有諗緊咧嚇，即係我哋喺電視咁樣，哇見嗰啲其實真定假嘅咧嗬。咁我唔敢話佢假嘅，你點睇真同假咧嚇？
其實有時真係做到好靚咧，係分唔到嘅。咁我覺得咁 OK 啦，咁你做得唔靚。咁點解我哋會見到個人係覺得佢假？第一，即係膠面係咩嚟咧？咁膠面可能打 filler 咧，你打到成個即係腫得滯啦，成個人。咁可能係個病人要求，或者個醫生嘅審美唔好，或者個醫生貪心，亦都可以嘅。咁你打喺啲唔啱嘅位置，咁有啲地方我哋應該係凹噶嘛，唔應該係脹起嚟噶嘛，唔係所有凹嘅位置先至可以打。咁而家好興啲叫做網紅樣啊，就係全部都圓晒嘅，成塊面都冇角度，好似個波咁樣。咁呢啲咪好唔自然咯，係啊。咁膠面嗰啲硬嗰啲就係因為你譬如打 Botox， 你係冇晒任何嘅 facial expression， 咁你笑都唔喐嘅，咁呢啲就好唔自然啦。咁同埋之前都講過，即係你 as you age 你係會知道係會有啲嘢發生噶嘛。咁你知道 Timothy， 我而家接近50歲，我應該呢啲位置係會有啲凹，應該係會見到多少苦紋。咁我填到所有嘢都平晒嘅，你就覺得嗰個人應該係有啲嘢奇怪，有啲嘢係做咗啊咁樣。
所以大家都明咧，有時啊，我哋細個嗰陣時睇嗰啲唱歌嗰啲，咦點解佢而家仲後生過我哋自己嘅咧？咁大家都明白。不過咧，我又想講啦嚇，最近我先前嗰幾集都講呢個羅剎海市有首歌，咁啊講咩叫美，咩叫醜。其實咧，我諗樣即係其中一個部分嚇，就係我覺得即係個心裏邊如果靚咧，個樣一定會靚。不過我諗啲女同事就覺得哇，我其實按完 call 咧出晒啲眼袋啊，即係頭先你嗰啲相咧，有時我哋喺 department 都見到，可能都要即係考慮下揾阿 Timothy 都唔定。咁嗱，今日我哋講 Paediatricians 咧，我係想問翻一樣嘢啦。喺你個 practice 裏邊咧，啲年青人揾你係即係因為咩原因多咧？因為頭先你講嗰啲好多都係啲即係比較即係 mature 啲嘅人啦咁樣。如果年青人揾你，多數係因為啲咩原因咧？
OK， 咁即係 late adolescence 或者 early adulthood 啦。咁其實可能佢哋會想揾工嚇，即係或者想靚啲 for 男朋友。咁最多咧，因為佢哋嘅外輪廓出邊咧係未老化嘅，咁所以最多都係填中間嘅嘢。我想個鼻哥高啲，我想個口唇冇咁薄，我笑得靚啲，我想個下巴尖啲，影起我瘦啲，或者個樣係更加 confident。咁男士都有喎，即係譬如如果你個下巴係即係縮咗落去，咁有啲都有啲 micronathia 嘅男人嘅其實，咁你揾工即係你望落去，即係好似唔係好夠 confident， 或者個樣唔係好吸引咁樣，咁所以佢都會要求佢打呢啲中間嘅地方嘅其實嚇，咁同埋都。wrinkle prevention 都會，即係見到自己啲父母老得好快咁，佢都會想我有冇啲其實即係 medical aesthetics 我講咁多呢啲填充嘅嘢，其實我哋個 ultimate aim 係去 age gracefully， 我哋係唔想唔 age 啊嘛 ，aging is normal 係啊咁樣樣，咁所以青少年係會咁，同埋激光啦，激光即係我留翻下一個抽，點解我呢度101就剔？因為我其實仲有201、有301、有401係可以去講嘅嚇，即係激光打斑啊嗰啲嚇都係一個好 common 嘅嘢嚟揾我。脫毛啊咁樣，
咁其中一樣嘢，我哋成日都有啲 patient 會話俾我哋聽，喂，我啲暗瘡咧搞到好多 scar 啊，或者即係都好，即係令到佢哋個 psychology 好受影響。咁如果走嚟揾你，你會點樣 advice 咧？會，
呢個就係301，呢個就係 laser 啦。呢個其實或者下一次可以直接講 laser。即係其實而家如果譬如啲 atrophic scar，其實係因為塊面係好多 fibrosis，咁所以我哋要揾一個方法去 remove 呢啲 fibrosis。咁而家係有 fractional laser，咁呢 fractional laser 就會係 中間係會射一啲好高能量嘅激光去直頭去 burn 走一啲 fibrosis， 不過中間又遺留啲正常嘅皮膚，等佢可以快少少去愈合。咁所以而家 depending on 你個 degree of 即係你開幾強嗰個激光，或者你用邊一部儀器咧，其實個 recovery time 可以由1個禮拜效果好，或者係啲冇咁強嘅，可能只得2-3日微微紅，依然都可以返得工嘅。咁呢啲都係可以去做嘅，不過當然可能需要多少少嘅 treatment 啦。
咁咧就網上咧有一個題目，咁咧佢就話出面嗰啲診所咧做眼袋手術咧就唔使全身麻醉，只要咧1-2個鐘頭，用3-4萬就搞掂啦，又唔使入院，信唔信得過㗎？佢話咧我本人天生戴眼袋，咁好想解決喎，點算咧嚇？
其實眼袋手術就真係好值得做嘅，呢個早做早享受，呢個我成日都講。咁其實原來係一個好簡單嘅手術，咁嗰日我都有機會去睇。咁就其實佢喺眼呢度下邊嗰個眼裏面嗰個 conjunctiva 咧，個 inner conjunctiva。佢係戒一戒，咁佢打啲局部麻醉。咁點解佢唔全身麻醉你呢？係因為其實你係要好似我而家咁呢，坐起身去做嘅。咁因為你坐起身先係拋個眼袋出去，你瞓咗呢，個眼袋就會平咗噶啦。咁佢就好似，因為我哋啲眼袋係一啲脂肪嚟噶嘛，咁佢就好似掹紙巾一個盒，有太多紙巾喺度，佢就逐啲咁掹到佢覺得平啦。佢叫你望下上，望下左右，覺得 OK 呢，咁佢就聯翻埋嗰個好細嘅喺裏面嘅拉咧，咁就完㗎啦。咁其實係冇任何 scar 嘅，好犀利喎，係啊，
即係都係要揾啲有經驗啊。
呢個係啦，揾 plastic surgeon 呢個係啦，
係即係你唔會做嘅你。呢
個我冇做手術，咁我係 physician 啊嘛。咁暗瘡我揾我，其實即係我咁多醫學美容嘢，其實我個 clinic 咧同即係一般嘅美容院好唔一樣，就我做好多 clinical 嘅嘢嘅。咁即係我做好多暗瘡，我醫好多 eczema 係啦，即係我。暗瘡個病醫完再醫暗瘡嘅印，再暗瘡嘅啦，咁呢啲我即係 all the long 咁樣會做啦，係啊。
咁我諗呢個咧就要等我哋下一堂啦，咁遲少少再揾 Timothy 講下呢啲。不過咧有啲而家大家都追求呢個美白啦，係嘛？即係曬都唔肯曬啊，直情咧就夜晚出街都要搽防曬啊，遮住曬咁樣。咁呢個美白嘅問題係咪好困擾即係你啲 patient 嘅？
係嘅，咁其實太陽嘅傷害咧，不但止係美白，其實傷我哋皮膚最多咧係即係當然係太陽啦，第二食煙啊，咁第三即係 lifestyle 嘅嘢啦。咁所以太陽我嗰陣時喺澳洲讀書係嚇親嘅，我未見過啲人啲皮咧係好似樹皮咁樣嘅，即係真係好老好巢晒咁樣。咁美白都係嘅，咁我覺得其實好多都係 genetic， 唔好咁介懷啦。即係我覺得唔係一定白先係靚嘅嚇，即係最緊要好似陳醫生講嘅心境啦嚇，即係好多好黑嘅都好靚啊。其實即係總之你係要有個 healthy glow 咯，我覺得嚇，唔一定要白嘅係。
我諗呢個好準確嚇，即係因為我哋唔好一個 stereotype 咁。頭先你講啦，啲網紅一個樣咁樣，原來即係 off 咗 camera， 另外一個樣都幾弊。
其實好恐怖嘅，係啊嗰啲。
其實幾恐怖嘅。
好恐怖嘅。
咁我試過一個細路仔話俾我聽啦，咁佢好笑，佢話唔知點解我哋屋企咧夜晚有另外一個女人出現嘅。佢真係喎，呢個小朋友真係咁同佢係，覺得大概4歲咁。咁我覺得哇，都幾有趣呢個故事。嗱咁咧，我哋今日仲有一個問題喎。介紹就唔好喺呢度講啦，介紹邊個醫生就唔好喺呢度講，我哋唔答你呢條題目。咁嗱呢個我諗我哋而家去到呢一度咧，已經知道其實咧我哋對醫美咧認識真係實在太少。其實有啲項目咧有啲 treatment 其實真係幫到我哋即係 patient。第一樣，第二樣咧，我諗大家都有呢個經驗，會有好多人會問我哋啲即係問題。咁有時作為一個醫生咧，完全即係唔清楚咧，又好似唔係幾好咁樣。咁所以咧就我都好感謝阿 Timothy 今日即係嚟呢度解答咗好多問題，同埋對我嚟講都係大開眼界。原來我哋做到咁多嘢嚇，咁同埋好多嘢都可以幫助到我哋啲病人。咁咧就我有個訊息話俾大家啲聽眾觀眾聽啦。我哋啱啱個 subscriber 咧就去到2.9 個 K， 即係有2100個同事 subscribe 咗我哋嘅 channel。咁如果有啲同事未 subscribe 嘅，大家都麻煩 subscribe。個好處係咩呢？我會將有啲片呢，有時間時嗰啲片呢，剪輯過呢會擺喺度。咁呢應該仲有好多片喺度。咁如果你 subscribe 咗同埋 get notify 呢，就會知道我哋有啲咩片出現。咁第二樣嘢呢，就好多同事就同我講話。Charles 先都好特別啊，因為咧有啲好唔同嘅 variety 啲 talks。今日呢個咧就係其中嘅example啦，即係我諗喺其他地方大家都未必有機會聽到呢個。咁如果你有啲 topic 咧，你想聽到嘅，不妨就 email 話俾我聽。咁咧等我即係去請嗰啲有關嘅 speaker， 又或者你覺得有啲 speaker 咧，佢有啲好特別嘅insights 嘅，你又可以建議俾我，等我嘗試請佢嚟。咁今日好多謝 Timothy， 咁咧就嗱，你應承我咧繼續講頭先講202啊303嗰啲，咁咧我哋揾一個時候再請你嚟講。咁就後尾你走咗之後咧，其實我即係離開咗 UC 之後，我都諗其實唔緊要嘅，你喺邊個崗位其實都幫到啲病人。咁你記得有一句我同你講嘅，最緊要做一個好醫生。咁我諗即係我頭先同你傾偈啊，同埋之前我同你傾偈咧，我深信你係一個好醫生。咁咧我喺台面咧有一個紀念品咧預備咗俾你嘅嚇。咁咧
多謝，
就寫住以義為先嚇。咁呢個咧就我覺得Timothy 係做到嘅。不過咧佢嘅方法咧就同我哋有啲唔同。但係呢個 aesthetic treatment 其實對啲小朋友啊或者年青人咧，都係非常非常之重要。咁你今日好多謝 Timothy 上嚟幫我哋分享呢個好有趣亦都好獨特嘅 talks。咁咧就期待第2、第3次你嘅 talk。好，
一定會。
多謝晒 Timothy， 多謝晒。好，拜拜。